So we have to sometimes consider extractions when a patient does not have the financial means to complete care on a particular tooth. And you also need to consider extractions when you're dealing with someone who has a chronic and a very heavy meth use problem. Meth use is a very hard drug for people to quit. In fact, 70% of patients who successfully completed a rehabilitation program 4 years after completing this program return to their meth use. So methamphetamine is a very hard drug for people to stop using, and you have to take this into account when you are developing a treatment plan. There are times when it is appropriate, unfortunately, to extract teeth. But we also want to think about when we're dealing with teeth that have a really good periodontal, endodontic, and restorative prognosis. We obviously want to restore these teeth. And because we're dealing with so much decay, oftentimes we need to really think about addressing caries in a holding care approach. For years, and I would say probably for about 18 of my 20 years treating patients with meth mouth, I have been using glass ionomer, and I've been using it quite successfully. It's a great interim restorative material for individuals that have high caries rates due to their methamphetamine use. And the reasons why I love glass ionomer is because, one, it's super easy to apply. As many of you I'm sure know, you can apply it in a moist environment. When that glass ionomer interacts with saliva, it is releasing fluoride. So once again, we're promoting remineralization. It's allowing the marginal interface of the restoration to be fairly caries resistant. And as a interim restoration, once you've completed your caries control, you can always go back and cut back that glass ionomer and do a composite overlay. And you have kind of the double benefit of having that glass ionomer serve to replace the dentin, and then the composite to not only replace enamel, but to provide you with the aesthetic that you want. So glass ionomer is a great material to kind of help you get control of the amount of caries that you have in a patient's mouth.